Okay. Hello, everyone. So welcome to Stockholm World Water Week. We are presenting on the integration between WASH and the treatment of severe acute malnutrition. And the session will be essentially informative, but we'll have a room at the end of the session for an exchange and for your questions. You will be very welcome to put them on the chat. The session will finish 11 o'clock sharp CET, because we are just moving to a session to prepare the COP28 just after this one. So you're very welcome. I'm going to present the panel who will support me on this presentation. So we have in the room Jamal Shah, who is a WASH specialist at UNICEF New York. And it's 4 o'clock in the morning for you, Jamal, so thanks a lot. You're our hero today. Then we've got Kate Medlicott, who is the sanitation team leader at WHO Geneva. Thanks a lot, Kate, for joining us. That's very appreciated also. And we have also Brigitte Tonon, who is the Regional Health and Nutrition Advisor for ACF, and she's based in France. Myself, I'm Jean Lapègue. I'm the Senior Advisor WASH for ACF France, based in Paris. So I hope that you can all see the slides. Can you? Yes, is it okay? So the objective of the session are basically to come back a little about the link between WASH and undernutrition. Then we are going to present you the ongoing research that we have in Senegal called the TISA. And then after we will open a discussion about the added value of a WASH kit in the link to the treatment of severe acute malnutrition, but also we'll discuss more globally about WASH nutrition integration. So let's start first by setting the scene. As you probably know, there are 4 types of undernutrition. The wasting, which is a low weight for height. Then the stunting, which is a low height for age. And then the underweight, the body mass index, if you prefer, and micronutrient deficiencies, like deficiencies in terms of iron, folate, vitamin B12, etc. The project TISA is focusing on acute undernutrition, which is connected to short bits of undernutrition. And the cutoff values for that are either a MUAC, so middle upper arm circumference below 11.5 centimeters, either a WFH indicator below 3Z scores, either bilateral edemas. So you see, we are concentrating our project on this form of undernutrition, which is not the most abundant, but which is critical. If we have a look at the under 5 children malnutrition figures, we have currently in the world 45 million of children who are wasted. And out of that, we've got 13.7 million who are suffering from severe wasting. Most of the children suffering severe wasting are living in Asia, but we have 3 million of them who live in Africa. Then the project, the TISA project, is developed in the north of Senegal. And in Senegal, we've got a little more than 30,000 children who are facing severe wasting. And you see that the prevalence is a little higher, 1.5 in rural context rather than in urban context. Something which is pretty alarming is that when we look at the figures in Sahel, the health admissions for severe wasting are increasing, and in 2022 they have been increasing by 31%. So this is a real concern. If we have a look at the figures of under 5 malnutrition globally in the world, you can see here that the wasting cases are concentrated in Southern Asia, but you can see also that in Africa, the main region affected by wasting is West Africa. So this is something to keep in mind. West Africa is the most affected by wasting. When we look at the Senegal figures, you can see that in terms of GAM, if we compare Senegal to the West African region, the data in Senegal are a little higher than in the region. But if we look at the SAM, at the severe acute, we are a little below the regional average. Now, if we have a look at the WASH figures in Sub-Saharan Africa and in Senegal, on the left of the presentation, you've got the access to water and the progress between 2015 to 2022. And you can see that globally, there is a progress in terms of access to either safely managed water, either to basic services. What we call basic services is when you have a safe water point at less than 30 minutes in and out from your location. So this is pretty encouraging. When we look at the IGN figures, which is the column on the right, you can see that the figures are extremely stable between 2015 and 2022. We are speaking about Sub-Saharan Africa. There are no progress. So how does Senegal position itself? In terms of water, Senegal, in terms of access to water, Senegal is above the Sub-Saharan Africa data, which is pretty encouraging. And if we look at hygiene, we can see that Senegal is below the data. It's half of the average. So for the TISA project, the issue of hygiene is critical. Just one remark, because we've got an assessment specialist with us in the panel. The TISA project is focusing on access to water and hygiene. We don't tackle sanitation, and we may discuss about that after. Most of you know, I guess, that there is a sort of vicious cycle. There is a strong connection between diseases and undernutrition. Basically, when you're suffering undernutrition, you are going to, this is going to affect your immunity, and it's also going to affect your barriers, like, for example, the small gut membrane. And then you are going to be an easy target for infections. And then you may develop infections like, for example, diarrhea, but also you will be more targeted by acute respiratory infections. And then when you suffer intestinal infections, enteric infections, then you are going to reduce your appetite, but also you are going to develop catabolism, meaning that you are not going to absorb the nutrient, but to release the nutrient with the excreta. So you see, this is the vicious cycle that we need to break in order to sort the undernutrition problem. And of course, on the left of the figure, you can see the WASH sector. The WASH sector is really there to help on that. And this is what we are going to discuss. That's why also the water and sanitation sector has been integrated in the nutrition sensitive approaches. So basically, you see this list of 10 approaches. They are here to control and to tackle undernutrition, and WASH is part of that. So again, undernutrition is not only about access to food, but you can see that it's much wider than this, and that the health dimension is very important. So now let's go to the TISA project. So TISA means Traitement Intégré de la Sous-nutrition Aiguë, Integrated Treatment of Acute Malnutrition. The project is developed in Senegal. It's ongoing at the moment. And basically the research question is, can the addition of a simple, and the word simple is very important, a simple household water treatment and hygiene promotion can have an effect on CMAM treatment recovery, on severe acute malnutrition, community treatment recovery. And this key research question is detailed, is disaggregated in 4 sub-studies. You've got one sub-study which is going to be about the effectiveness of WASH intervention on the recovery rates. You're going to have another sub-study which is about the effectiveness of the WASH intervention on drinking water quality, so the health environment, let's say, of the families. There is also another, the third sub-study is about the cost effectiveness, feasibility, and acceptability of the WASH intervention. And the cost effectiveness is absolutely central because we want to upscale the intervention when the research will be finalized. And finally, there is a sub-study which is more about the participants' exposure to enteric pathogen and antibiotic resistance genes. Regarding the partners of the studies, so we have scientific partners, the London School of Hygiene Tropical Medicine, Action Against Hunger, both Action Against Hunger Spain and Action Against Hunger France. And then we've got the University of Dakar and the L'Artes Laboratory. This is for the scientific partners. In terms of operationality, it's essentially ACF Senegal and ACF Spain who are running the project. And then we've got the external partner and the funding partners, the Ministry of Health of Senegal, UNICEF Regional, and then in terms of funding partners, we've got BHA USAID, which is the main donor, and then we've got the SENS Foundation, and then the project is also supported by the ACF Foundation for Research. As you can see, we have partners who are directly from the country, like the L'Artes, and also from the region, like UNICEF. This is very important. About the scientific protocol, the project is a randomized controlled trial with 2 arms. So a randomized controlled trial is a type of research that is developed when we try to demonstrate something or to improve a protocol, to improve a treatment. We are going to compare 2 arms. Each of the arms includes nearly 1,000 children under 5. And the 2 arms, basically, one arm is going to follow the standard Senegalese nutrition protocol, and the other arm is going to follow the same protocol plus a little WASH intervention. And we want to see the effect and possibly the impact of that. Regarding the study population, we are using OTP admitted uncomplicated SAM cases, so cases of severe acute malnutrition, which are aged between 6 and 59 months. And these participants are going to follow a standard 8-week treatment of the severe acute malnutrition, and the sample size is minimum 1,720 children. In terms of setting, so I will show you the map just after, but basically, we are following this project with 86 health centers from 4 districts of the north of Senegal. Regarding the enrollment and the results, so the project started its enrollment in December 2020. It has been finalized in April 2023, and the results will be published between the end of this year and the beginning of 2024. You can see here the map of the project with the key areas, so the zones of Linguere, Dara, Podor, Ndium, and Pete. And this is where the 86 health centers are located. If we come to the scientific protocol, if we come to the scientific protocol, we can see that you can see on the right the 2 arms of the randomized controlled trial, the arm with the intervention in orange, and then on the right the control arm. And you will see also the treatment duration between week 1, where you have the enrollment, and week 8, where you have the discharge at the end of the treatment. The specificity of the randomized control trial is, again, one arm, the control arm, is following the National Nutritional SAM-CMAM treatment, which includes the distribution of plant peanut. sensitization, infant and young child feeding, and then the national medical treatment package. And then what we add to the intervention arm is the WASH package, which is including a WASH kit that I will detail later, and hygiene promotion flyers and household visits. And at the end of the project, we share also this WASH package with the control group. I think there are some questions in the discussion. Is there anything critical, or is it just a question about the project? Kate, can you have a look at that? Or okay, so
it's okay, Jean. It was okay. Only one question asking the meaning of OTP. That's all.
Okay. But please answer to it, Brigitte.
It's done.
Thanks a lot. Thanks a lot. Sorry, I don't see the chat. Perfect. So we have the 2 arms. We have the 8 weeks. And you can see that in the intervention, after distributing the WASH package, we are going to have a household visit at week 4, more or less. So at the median of the treatment, where we are going to monitor a water sample and food samples in 400 households. And then also at week 8, something pretty important, just before the discharge, we are going to do rectal swabs also on the children, and I will show you why we are doing that. Here, when we look a little at the analysis and the results of the scientific protocol, you can see also the timeline on the left, and then you can see also what are the type of analysis that are done and the results. In terms of results, I think what is extremely important, the most important, is the effect of adding a WASH package to the SAM recovery rates. So that's a major result. But you can see also that we have results, more soft results, like acceptance of the WASH package. Of course, the effectiveness of the water treatment, and you see that this is measured by measuring E. coli contamination, total coliform contamination, etc. And then after we are monitoring also in the excreta through the rectal swabs, 32 enteropathogens and also antimicrobial resistance genes. And we have also at week 8 a blood analysis, which is going to show us the infection history in the SAM children. One specificity also is that we are not only checking the quality and the hygiene of water, but also of food. Regarding the WASH kit, the kit should be not too expensive, but not too cheap. Why not too expensive? Because if not, it will be absolutely impossible to upscale. And the kit is provided upfront by UNICEF, but it should not be too cheap also because it should be effective. And so basically you have the content of the kit here. I'm not going to read it. You've got the 2 times of distribution, week 1 for the study arm, week 8 for the control arm. And obviously you've got some prerequisites that we'll discuss later. About the theory of change of the project, this is the core of the theory of change. You can see that there are 3 key pillars on this project. The most important is the one in the center, is strengthening the national treatment protocol of Senegal. Then we want also through this project to improve processes of research. It's the pillar on the left. And then the pillar on the right, we want to improve our knowledge of the determinants of malnutrition. So basically these 3 pillars are going to lead to 10 results that will be available early 2024. So this is the core of the theory of change. Obviously, there are many other things that you will be able to access at the end of the presentation. In terms of results, the first block of result is about strengthening the community management of acute malnutrition protocol. And here you can see that we have 4 results included into this big block. One is about the effectiveness of adding a wash kit to a SAM treatment. Another one is about the acceptability of the wash kit. The third one is about cost effectiveness of the wash kit in the SAM treatment. And this is very important if we want to engage Senegal and possibly other regional countries to adapt this their protocol. And then after, we've got a result about environmental impact of the TISA project, which is a standard protocol in ACF research. So that's for the first block of research, focusing on the SAM treatment protocol. Regarding the second block of research, which is about improving our knowledge on the determinants of SAM, there are three results that are expected. One is the evaluation of the enteropathogens and the antibiotic resistance. The second one is the analysis of water, and the third one is the analysis of food. What is really essential is to understand that the wash routes of contamination connecting wash and undernutrition could be either water, sanitation, and hygiene. And you can see the three routes here on the figure. For the specificity of the TISA project, we are just focusing on water and hygiene. And we'll discuss that maybe with you, Kate, about that. But it was a decision taken at the beginning of the project because of the upscaling capacity of the project. And a specificity we have on the TISA is also to focus also on food contamination. And you see that food contamination is either connected to hygiene, obviously hand hygiene, but also it could be connected to water contamination. Maybe you know, but the relation between a poor wash and a poor nutritional status goes either through diarrheal diseases, either through soil-transmitted ailments like trichuriasis, like ankylostomiasis, who can develop also anemia, or like tenia. And then after, you've got a sort of black box, which is the environmental enteric dysfunction, which is a disease affecting the small gut membrane and provoking issues about absorption of nutrients. So ACF, through this project, is going to try to explore a little more deeper these routes of contamination. And for this, we are going to test 32 enteric pathogens, either viruses like rotavirus, either bacteria like E. coli, either protozoa like Giardia, either worms like Ascaris. And so you see, this is absolutely interesting because it has hardly been done in the past. There has been a work done by Maryland University, by Rita Colwell in the past, but for the moment, we don't really know which are the enteropathogens connected with undernutrition. So there are many questions that we'll be able to answer, we hope, based on this analysis. First thing, is there a connection between severe acute malnutrition and specific enteric pathogens? Are there associations of pathogens between them? Is there a correlation between the type of pathogens, the duration of the treatment, etc.? So you see, this is going to be a very interesting piece of research. Finally, we've got the block 3. The block 3 is about improving the quality of the research processes. We are going to evaluate the challenges that faced the research, and there are some challenges already listed here. There are probably many other ones. We are going also to have a look at the cost analysis of the research in detail. And then after, we are going to explore the scaling up. Obviously, we are doing research because we want to upscale then the adaptation of the protocol if it works, and we want to develop more research. So I don't go in the detail of the challenges, but as you can see, we are working on 86 health centers, which is a lot. We have been facing, of course, the health system, the local health system, some difficulties. I don't know, logistic issues, strikes, etc. We face the COVID, And also we are working in a pastoralist area, which can complicate also the access to children, the access between children and health centers, etc. Regarding the expected outcomes of this research, first you can see that there are a lot, 27 outcomes. We will have 7 scientific publications, essentially on the block 1 and the block 2. But we are going to have also technical reports because we want to have an operationality of the research. It's not a pure research, it's a research that aims to become an have operational consequences. And then we'll have also some kits about communication. And then the actors we are working with, and who are also both our partners and somewhere our targets, first thing to keep in mind is that even if the research happens in Senegal, there are other countries in the regions that are affected severely by acute undernutrition. I'm thinking about the west of Mali, I'm thinking about Mauritania, I'm thinking about Gambia, etc. So the regional approach is something very important for us. We are connected to the UNICEF regional office, obviously, in Wakaro. And this is something to keep in mind. Obviously, the project will have also a resonance at international level, especially if we have good evidence of this project, and especially possibly about the analysis of the enteropathogens. But the core of our project is about Senegal. And here we are, of course, going to be accountable to the communities where we have been developing the project. We are going to work with our donors in Senegal, and a very important partner for us is the Ministry of Health. So you see, this is a little the grid of the partners we plan to target and to engage during and after the project. Now we are going to open the discussions, and the first discussion is about does WASH works on acute undernutrition? And before opening the door to questions, I just want to show you a couple of slides which are illustrating a little this question. And I'm sure that in the room you may have your opinion on that. First thing, the connection between WASH and acute malnutrition, we have mixed evidence on that. We did in October 2021 a systematic review, supported, by the way, by Tufts University and the London School, and also the Global Nutrition Cluster. And this systematic review that was developed on 25 studies, it's not a lot, demonstrate that we couldn't show any effect of a WASH intervention on the prevention of acute, I insist, on the prevention of acute malnutrition. However, in terms of treatment of acute malnutrition, through 2 studies that have been screened, we managed to demonstrate that a WASH package can have an effect on the treatment. So how can it have an effect on the treatment? First, because it's going to improve the recovery rates. And you see that in Chad, a WASH kit has been increasing the SAM recovery rates by 10%. Then it can also reduce possibly the length of the treatment, which has been the case in Chad also. And you can see that in Pakistan, where we have been testing point-of-use water treatment, so testing chlorine tablets like Aquatab, Procter & Gamble POW treatment, so flocculation and treatment, and ceramic filters, you can see that here we had a very interesting impact also on the recovery rate of children, between 16 and 22%, which is massive. However, none of these 2 studies demonstrate any effect on the SAM relapse. So the SAM relapse after the recovery remains a big question to explore. There is a systematic review which is currently under review, currently ongoing, that ACF is developing with the London School of Hygiene and Tropical Medicine, where we are exploring the relation between WASH and the SAM relapse. And so we don't have any results to share with you for the moment. It's embargoed, but obviously this is going to be important because it's still a massive question about the impact of WASH on some relapse remains a big question. So to summarize, here it is. In terms of prevention of undernutrition, WASH has no effect either on the chronic undernutrition, so the stenting, either on preventing acute malnutrition, the wasting. And then we have got a big question mark about the effect on SAM relapse. In terms of treatment of undernutrition, the WASH kit distribution has an effect on the SAM treatment recovery rates. It has an effect also on reducing the length of the SAM treatment. And the improvement of water quality at household level is demonstrating an improvement of the recovery rates. So you see, this is the summary of the effect of WASH on the SAM treatment. And based on that, now we are going to open the floor to questions. So I'm going to turn myself to you, Kate, with the first question, which is which type of WASH intervention should be promoted from your point of view to contribute to nutrition outcomes?
Thank you. I'm probably not going to say what you want to hear here. I'm feeling a bit sort of triggered listening to that presentation because I'm sort of thrown back to the WASH-B SHINE trials and frankly what the nutrition community calls a WASH intervention. So they say, like, yeah, WASH doesn't work for these outcomes, but it's not a WASH intervention that you're implementing, right? It's a very limited intervention. What's really clear, so you don't really need to do a randomized controlled trial to show you're probably not going to get a health outcome from that. What we know, and you look plausibly along the causal pathway, what's going to block transmission, a very limited WASH intervention is not going to do it. So, I mean, of course, do the trial, and I really hope you get a good result. But we need to be very clear about describing what the intervention is before saying WASH doesn't work for nutrition. And when we're talking about WASH, we had this really nice feces study paper some time ago that showed, what you need to get a health impact across a whole range of health outcomes is a clean environment at the end line for everybody in the community. So it's not like just some water treatment. Sanitation is left out of this intervention. That's the root cause of where this contamination is coming from. So we can't keep kind of hoping that these small scale cheap interventions are going to achieve results. If you're listening in the conference here today, you hear everyone talking about proper systemic change, long-term service delivery, professionalized service delivery, not leaving households with very small interventions that you hope is going to make a difference. So we need to have proper water supply, proper sanitation at home for everyone in the community, not just the affected families. We need decent hygiene, and we need animal waste management. And I think if those things are not in place, it's a little bit futile almost to do these trials and expect a result. So yeah, what can I say? We've seen a number of these come out, and I really hope for all of you that you get a good result from this. But I feel that this will be another study in the books that says WASH nutrition doesn't work, and I think plausibly that's not true. We just need higher quality interventions, and we need to accept that those are long-term, difficult and expensive, but ultimately worth it.
Okay, thank you very much for this comment and this answer. I think that the SHINE trial were focusing on stenting, not on wasting. So it's really different. Maybe Brigitte or Jamal, feel free to intervene on this question. Jamal, maybe you want to say something?
Yeah, thanks, John, for the presentation so far. I think, I agree with Kate. WASH, one, of course, it is a bit broader than just water. Of course, and sanitation has a very important role in this. We did a study, I think that was a few years ago, probably in 2016, and that's more in the East Asia context, which showed sanitation to be one of the contributing factor, quite major contributing factor in towards nutrition outcomes. There has not been, I mean, this is of course, and it is very welcome that this types of studies are taking place, and there has not been many studies which shows the relationship between wash and nutrition, but it's quite obvious that I mean, overall the environment, and particularly the water in the glass, and by I mean water in the glass, I mean the point of use where you actually take the water into your mouth. That is important that we have that water quality analysis, and we ensure that the household at the household
Yes, I think we've got a little problem with your connection.
Actually drinking it is clean. And the technology is can you hear me?
Yes, go ahead, please. Yes. Oh, no.
Yeah, I mean, so my point is that yes, it's all water and sanitation and hygiene.
Thank you. I wanted
Sorry,
to...
back to you, John.
Yes, thank Jamal. Can you hear me? Yeah. As you said, the connection between undernutrition and the environment is multifactorial, very complex, with a lot of contributing factors. So the design of this study, and it's we are speaking of a 5-year study. Huh? The design of this study is precisely to explore one bit of it. It's very difficult to have a global vision about all the factors together. So it's humble. So it's not the Father Christmas wishing list. Sorry, Kate. It's humble, but we are progressing step after step. Maybe Brigitte, you want to tell us a little more, either on the SHINE, maybe research, or
not so much, but more to go back on what we can do, because indeed we are really trying to have a bigger impact and to have some macro intervention, looking at the global environment where the most vulnerable population are living. So it's true that for example, intervention like providing wash kit can be seen as a small one, but in fact it can have a huge impact on the recovery rate, for example, for children suffering from severe acute malnutrition. We hope, for example, that it can reduce as well the rate of relapse, because one of the main issues we are facing in nutrition program is that we can treat children, but as long as they are going back home with unsafe or unhygienic condition, we may have again these children coming back to our nutrition program. So, and back to what Jamal was saying, today we are really trying to work on the point of use of water. So it has to be at health facility level, at community level, at household level, but that's a core priority to ensure that water that is drunk by children and family members are safe and of good quality,
Thanks a lot, Brigitte. Before taking some questions from the room, from your point of view, what are the next researches that need to be done? We spoke a little about this big question mark about the relapse. Is there any other thematic we should explore in terms of research on wash and nutrition? It can be either on the hard side and on the soft side, obviously.
There was a question about it in the chat, John. I don't know if you want to acknowledge this comment, yes, because it's something I was saying that we will discuss about it during the session. But I know that we have done this R4 Act a few years ago, maybe 3 years ago, when we had a long review on what type of wash intervention are effective compared to some that may be less effective or not effective at all. Today, again, for me, one of the priorities about relapse and to make sure that we are capable today to improve the condition at household level. One of the, we know clearly the pathway between unsafe water and severe acute malnutrition is clear. Now it's more related to interventional research. to see what kind of intervention have the biggest impact, I guess. But again, John, yeah, maybe you are.
Yes,
I will let you to acknowledge.
Yeah, thank you, Brigitte. I've got a question from Rahul. Thank you, Rahul, which is about the directing research toward generating solutions that are adaptable to society and accessible at an affordable rate, which is a little what we are doing for the moment with these very basic kits. So that's, from the point of view of Rahul, a domain that we should explore. Personally, I think that we should also try to explore soft side research regarding the upscale, regarding the political acceptance, etc. Because the idea is really, if something works, to take it to another level, to a regional or national level. And then I'm sure that there is some research about the governance and about the, the political strategies that could be really interesting. So that was a first, I'm looking at the time because we've got some constraints of time. That was the first discussion. I will go for the second one. The second question is about how do we plan to upscale and systematize WASH integration into nutrition. And we are going maybe to start with you, Brigitte, about what could be, from your point of view, good recommendation for having a proper WASH nutrition sensitive project.
So thanks for this question, which is quite wide. Overall, I would say we need to work at each stage of a project, meaning first of all, it's during the assessment phase where we need to have joint assessment for really highlighting or better knowing the context situation. We know that all sites does not fit to all, so we need to adapt really our program to where we are working, and to make sure that we understand as well the undernutrition pathway in the population we are working with. The second one is, of course, during counseling and health promotion activities. It's where we can clearly have a great added value to work together with health and nutrition and the WASH team. I will regularly speak as well about health because at ACF, we are really promoting the alignment of health and nutrition programming. We are trying to avoid, in fact, to have nutrition vertical program and to make sure that we are offering an holistic management of children and their caretaker or for women. One strong link I see for integrated program, it's really during community services, where we are present again at household level or at community level, where we can have joint session, community session together, like, or to have at minimum hygiene promotion session, joint hygiene promotion session. One, of course, when it's more at macro level, at institutional level, where we need to have integrated strategy and policies. That means as well funding allocated in a way that allowed, in fact, this integration. We know that sometimes we are suffering as well from silo for our own intervention, but as well silo in funding. So we need to advocate more and more to make sure that integrated WASH and nutrition and health integration are well financed together. And one point is as well during emergency, because we know that we can have a greater impact if we are merging all our effort, in fact, with the main goal again, it's really to reduce the mortality and morbidities of vulnerable or affected crisis population. And the last one, for sure, it's about research, as we are doing now. We clearly need to work together. One point for me, if we are more practical, is to scale up, for example, some approaches that have been proven efficient in some contexts, like the baby WASH, for example, or the baby WASH fit. The WASH fit it's one interesting project where we are in fact analyzing the WASH situ condition in health facilities. So as a nutrition and health team, we need in fact the expertise of the WASH team to come and to help us to define how best ensure hygienic condition in health facilities. We are doing the same now at community and household level. One big focus as well is required for the 1,000 days, which is really this window of opportunity when both sectors can have a great impact. And I will say again, just to end somehow, that we need to design overall, we really need to design work together, to design project together, to make sure that from the design stage up to the implementation, we are all on the same page.
Thanks a lot, Brigitte. That was very complete. And I like your last sentence, because I think that as a WASH project manager, if you really want to integrate, the objective of your project should be a nutrition objective. So, and your entry point should be nutrition data. I'm going to switch to Kate, to WHO, because you need to leave us very soon. I'm sorry, Kate. And you are going to speak a little about the question about how can we engage politics in this in this systemic changing and in WASH nutrition integration.
Yeah, thank you. I'll try and sort of cover a bit of the politics, but also the joint programming. I think there's, well, first to say, you know, for WHO, we've actually sort of neglected WASH and nutrition integration a bit. So that's sort of a mea culpa for us. We've been working more on linking with NTDs, WASH and healthcare facilities, and WASH fit, as you know, AMR, cholera, and so forth. But with our WASH and Health Working Together toolkit, there's some really kind of common things that we need to kind of bring together. And we've got two sort of communities who have a way of thinking and talking about things as kind of a process to build joint programs from the political level right down to the delivery level. And I think it's a really sort of long and sometimes difficult process of coming onto the same page and understanding, you know, finding shared goals, finding common language, figuring out how to combine budgets and planning cycles with sort of slightly different objectives. So you guys are talking about WASH and sort of emergency situations or nutrition, emergency nutrition interventions. And I think the first thing that we need to keep getting across is that, you know, WASH is not really an intervention, it's a service, right? And if we're going to have sustained long-term services, we need to be kind of thinking about it in that way. So not trying to like bolt on a little WASH intervention on top of a nutrition intervention, but actually work deeply with the WASH community to be making the case for high quality long-term services so that you don't have these recurrent outbreaks, recurrent crises. Yeah, so I think sort of that's I don't want to talk for too long, but yeah, sort of following those steps of building common goals, using the data from each community's practice to do joint planning and then joint program delivery, and just sticking at it. It's hard, and I think because of that we often retreat back into our silos. I'll stop there. Thank you.
Thanks a lot. Sorry. Yeah, thanks a lot for these points, Kate. I think also that a way to engage politics is to demonstrate that by providing a WASH kit or a basic WASH intervention, they are going to save money. Because if you improve the recovery rates, if you reduce the length of the treatment, you're going to save money globally. And this is one of the streams of this research. Because it's a very important trigger, you know, for politicals to be able to upscale this type of intervention.
Sorry, I just want to push back super quickly on that, because I think this is one of the things we've been getting wrong. We're saying, oh, you can do WASH really cheaply, you can save money. But actually what we need to be saying is you need to spend a bit more money upfront to create a high quality, sustainable service, and ultimately in the long run you will save money. Maybe you won't save money today, but ultimately you will, because you won't have these recurrent treatment costs. You know, you put more of that money upfront in the prevention effort. Sorry.
Yes, and you're selling the perfect scenario. I think again, you're right. We need to have a long-term vision, a real strategic vision, and this is the SDG approach. This is the human rights approach. Unfortunately, in the areas where we're intervening, sometimes we need to have a sort of medium path. Jamal, I'm turning to you. Do you have some points about those questions? And maybe the question we didn't touch was the number 2. the wash kit, what else? How can we complement? What do you think from an engineer point of view? Would you adapt it? Would you propose something else?
Yeah, so I mean, the wash kit, as you said in when you were explaining it, it should not be too expensive, and at the same time, of course, it cannot be too cheap also. So the one which is being provided, I think that is fine.
I think we are losing you.
The only thing is we need it.
Okay, so what I captured, because we have been losing you for a little while, that from your point of view, UNICEF, the wash kit provided in this research is fine.
Yeah.
Okay, okay. Very good.
But yeah.
Yes, please go ahead, please.
I just wanted to mention something on coordination.
Yes.
I think
Yeah.
that is very important because WASH is very fragmented. And if we want to move to scale, we need to have better coordination between WASH and nutrition.
Yeah, that's obvious and that's essential indeed. And this is what we have in this panel. It's really great to have both the WASH and the nutrition sector together. Let's hope that this could happen at a national, at a regional level. I'm just having a look. Is there any question in the room?
Yeah, you have some, John.
Okay,
Yeah.
okay. So we are going to pick one of them.
But one I can help you. It's why specifically is the intervention limited to water and hygiene with no sanitation?
Mm-hmm. Please go ahead if you want to answer. If not, Jamal or myself, we can answer.
Yeah, I think this is more for you because it's really related to the research setup, I guess, and the protocol of the research.
I think that the first, it has been done deliberately. It's not that we didn't want to do sanitation, and we are really in total agreement with WHO and with Kate on the importance of sanitation. But I think that the research again is a humble exercise. We are testing elements. In the past, we saw in Pakistan and in Chad that a wash kit works. We wanted to test it. We know also that sanitation is much more expensive and that if we want to plan an upscale, it's going to be a limit. So I think that this is why we decided to focus on that. It doesn't mean that we should not explore sanitation. We know, especially regarding the enteric worms, that sanitation has got a central effect. So yes, again, it's not something we forgot. It's something we decided for the sake of having a very structured and framed research. We still have a couple of minutes. If there is no other question, especially if there are no questions on nutrition, I'm going to we are going to close this this session. Is there any other question? Yes.
Yeah. You still have one. Huh? There was a question about the wash kit. So from Rahul. So the wash kit, in my view, is for the study purpose, or is it to make it commercial product? So in my understanding, we are providing wash kit in various projects, and so it's not something that we are only doing now in Senegal. We have been providing this wash kit with different type of composition and a different time as well of the management of severe acute malnourished children. Like, for example, you can decide to give it only at admission time or to give some different item during the times children are under your treatment, or you can even give it at the discharge as a kind of gift with all related to all the education messages you have been transmitted during your program. When we are speaking about commercial products, so indeed, it's products that we are buying at local level. I'm not aware, and Jean tell me, but I'm not aware of any livelihood intervention that merge with a wash kit. I know that we can do, for example, some small business economic model based on the kits for promoting, for example, women and with income generative activities. But I'm not aware if this has been done with a wash kit.
Yes, yeah, we are exploring such issues, especially there is an ongoing project in Bangladesh with ACF where we are trying to connect social enterprises with wash kits and wash elements. So it's something I think to explore. I'm going to move on, and also I wanted to say that UNICEF is very supportive on the wash kit, and it's one of your standard also delivery activities. A closing tweet from our two panelists. So a tweet is 150 characters. Is there a word, is there one sentence you want to say? Brigitte.
Break the silo.
Break the silo. I like this one. Jamal.
Involve governments.
Involve governments. So governance, governments, strategics. Okay, fantastic. So if you want to know more, about wash nutrition, you still have the wash nutrition guideline here, and I will share the link in the chat. If you want to go back to the TISA presentation in order to discover it a little more in depth, etc., you will have the link also. Maybe Brigitte, you can share those two links if you can. And then if you want to connect and discuss with us on wash nutrition, you can have this QR code and you can still exchange with us. So either you want to discuss more programmatically, and the focal point will be Samuel. So you have his email address here. If you want to come back on research questions on TISA, you have a focal point with Dienaba Ndiaye, and you've got her email here. So feel free to stay in touch with us. Again, this research, it's not an ACF research. We are trying to explore together in order to improve together. I wanted to thank you all about that. And for me, my last word is WASH is much more than nutrition. We all agree on that. Huh? We all agree on that. So let's keep in mind also all the dimensions of WASH that Kate tried to tell us about the dignity, about the safety, etc., etc. But I wanted to thank you a lot. First, the people who woke up super early to join us. Thanks so much, Jamal. It was a pleasure. I want to thank the nutrition department. Thanks, Brigitte. It has been really useful to have you on board and to help us on this because it's really a double entry discussion. And I wanted to thank all the people who have been attending, all the participants. You're very welcome to keep the exchange with us. Brigitte, did you manage to share the links?
Yeah, I was looking for which document do you want exactly? So, because I find the one for the WASH ACF WASH strategy.
We've got the link here. I think you just need to copy paste on the chat.
Okay, I see.
Can you do it? Yes, if you can do it, that would be lovely.
Okay.
And then the link to the presentation for people who want to go a little deeper with us. Bon. Thanks, everybody. Thanks a lot to the participants. I wish you a very nice day. And now we are going to switch to preparing for the COP28 and putting the WASH inside it. Have a very nice day and bye-bye from Stockholm. Thanks, everyone. Goodbye.
Thank you. Bye.
Ciao.